Association between fluid balance and survival in critically ill patients, published by the Journal of Internal Medicine. The purpose of this report was to investigate the association between fluid balance and survival in a group of almost 16,000 individuals who survived an ICU stay in a large urban tertiary medical center. The study used a longitudinal analysis, which is an observational research method in which data is gathered for the same subjects repeatedly over a period of time, and in this case it was a 7-year period. Cox proportional hazard models adjusted for severity of critical illness and electronic bedside record were used to determine the relationship between fluid balance during ICU stay and survival. Also, the Multi-Parameter Intelligent Monitoring in Intensive Care Research database was used in order to document over 17,000 patients who had a stay in the ICU of 24 hours or more at the Beth Israel Deaconess Medical Center in Boston, Massachusetts. The final sample was made up of 15,395 patients who met the criteria for the study. Of the 15,395 patients who met the criteria for the study, there were 1,827 deaths in the first 90 days after ICU discharge. Fluid balance was not associated with outcome of individuals without congestive heart failure or renal dysfunction. However, positive fluid balance is associated with post-discharge mortality, especially in patients which are most vulnerable to fluid retention, such as those with congestive heart failure or renal dysfunction. Perhaps paying careful attention to fluid balance and having a normal circulatory or blood fluid volume within their body at the time of hospital discharge may improve outcomes and decrease the rate at which death occurs. In summary, fluid overload is associated with mortality, and a positive fluid balance during critical illness had a significantly greater risk of dying within 90 days of ICU discharge.